Minister McGrath, I would like to welcome you to the chamber here this afternoon. Today, Minister, I would like to raise the issue of ambulance delays, particularly in rural Ireland. And one would ask the question, what chance do ambulance crews have if they don't know where they're going? And how can they quickly and efficiently find their way to patients, specifically in rural locations? And does the National Ambulance Strategy have a strategy or protocol in place? A number of incidents over the years have led local communities, especially in rural Ireland, to wonder how the service is directing its ambulances and how the crews are assisted in reaching an emergency once it has been called into them. Two incidents in July of this year involving the same unfortunate family in County Monaghan illustrate this point in its darkest detail. A 44-year-old husband and father suffered a cardiac arrest on the 9th of July in Ballybay town, but had to wait for 1 hour and 15 minutes for an ambulance to arrive at the scene. 999 was immediately called and CPR was carried out. A defibrillator was immediately brought to the scene and telephone contact was maintained with the emergency services throughout. A full hour after the initial emergency call and continued CPR, a strong pulse was identified from the patient, but a further 15 minutes elapsed before an ambulance arrived. Having travelled from Navan via diversion through Dunshaughlin and County Meath. Despite the very best efforts of all involved, 15 minutes later the man was pronounced dead in an ambulance at Main Street, Ballybay, before he could be transferred to Cavan General Hospital. On Tuesday, the 18th of July, the late man's father, who was in failing health, required an ambulance due to a dangerously high temperature. At 2:32 a.m. in the morning, his wife telephoned the doctor on call, outlining the condition of her husband. She was put through to ambulance control, who informed her that an ambulance was in Shercock, which is approximately 7 miles away. She gave directions and the location, air codes, etc., but no ambulance arrived. A full 1 hour later, their son drove towards Shercock to meet and bring the ambulance to the house, but encountering no ambulance, he returned to the house, where, following a series of phone calls to doctor on call, the ambulance was located sitting outside a local shop, totally lost, with no sat-nav or no contact telephone numbers for the patient's resident or family, having travelled from Monaghan town. 1 hour and 25 minutes later, the ambulance arrived to a traumatised household. The gentleman was transferred to Cavan General Hospital to be diagnosed with pneumonia. There have been numerous similar incidents throughout the country of delays of this nature, including one in Dundalk quite recently, where a young man bled to death after waiting over 40 minutes on an ambulance. HICPA have advised, and I quote, that the best practice is to have dynamic deployment of ambulances rather than having a strategic placement of vehicles, so the nearest vehicle will attend the scene, and that's what we are moving towards, unquote. However, in many areas, people are left with very low ambulance cover, including counties Monaghan, Laois and Sligo, where there are only 2 vehicles covering the entire county. I'm about to finish now. I'll just write out it. It's a serious issue, Minister, and one that needs to be addressed. And I know when local hospitals, the A&Es were closed, such as happened in Monaghan, we were promised that we would have a beefed-up ambulance service. Unfortunately, this is not the case. Clearly, it's a lack of services and a lack of personnel that's causing the problem, and we cannot allow a situation to happen again like happened in Ballybay. And we need clarity from the Department of Health. This won't happen.
Thank you, Senator. Minister.
Can I say, in relation to today's very important issue raised by Senator Robbie Gallagher, it is a very, very important issue. And the 2 incidents you mentioned there are very, very serious incidents. And I want to welcome this opportunity to address the House on the broader issue as well. I am aware that the ambulance response time in August for the North East region were below target. However, I understand that the NAS is working to address the issue and is working closely with the Northern Ireland Ambulance Service to improve response time for patients in border counties. Ambulance response times are helpful for performance measurement. However, it should be recognised that the sole reliance on response times does not provide a comprehensive picture of modern ambulance service performance. Response time performance is being globally reviewed as to whether they are only appropriate measure of patient care. Whilst rapid deployment and timely arrival is accepted, patient outcome indicators are now being viewed as a more appropriate measure of patient care and experience. A key performance indicator group chaired by Dr Philip Crowley, the National Director of Quality Improvement, has now developed KPIs in line with patient experience and outcomes, and these have been submitted for implementation. This is in keeping with the current international trends. I have also been advised by the NAS that it is improving regional coverage and deployment across rural areas. The NAS is moving away from the ambulance provision from fixed bases to dynamic deployment, and that was urgently needed in the two cases you mentioned there, Senator. This means that resources can be used across a region so that if a demand increases in one area, other resources can provide cover as required. With regard to locating addresses, I can assure a Senator that the NAS computer-aided dispatch system identifies both the incident location and the nearest available resource. The system also utilises the automatic vehicle location system, which enables the National Emergency Operations Centre's, the NEOC, dispatcher to direct the responding resources to the particular incident. I should also mention that the NAS is implementing a new vehicle system which will include a navigation tool. This will allow responding crews to view the same mapping system as currently available to the NEOC dispatchers to provide directions to incidents. This system will be rolled out during 2017 and 2018. The capacity review published last year identifies particular difficulties serving rural areas such as this region. The capacity review indicated that the only practical way to improve first response times in rural areas is through the voluntary community first responders, the CFR schemes. The NAS continues to work with the local CFR groups across the North Eastern region to enhance the services. I am advised that in August 2017, 25 CFR groups were operating across the North East region. The capacity review also examined all overall ambulance resource levels and distribution against the demand and activity. Implementation of the recommendations of the capacity review will require a multi-annual programme of phased investments in ambulance manpower, vehicles and technology. 7.2 million additional funding was provided in 2016 for the NAS, including 2 million in developing the funding. In 2017, an additional sum of 3.6 million was made available, which include 1 million to fund new developments. I can confirm today in the Shannon that additional funding will be made available for the continued development of the NAS in 2018, and this will be set out in the National Service Plan 2018.
Thank you very much. Brief supplementary.
Chair, very briefly. Thank you, Minister. Unfortunately, this family's experience doesn't concur with the statement that you have read out, but hopefully the future will look a lot brighter for other people. The family, through my good self, did contact the Minister of Health at the time seeking a meeting. Unfortunately, he wasn't available, but he did direct us to the National Ambulance Centre, who I've contacted with a view to getting that meeting. I would appreciate if you could use your good offices to assist us in that regard. Thank
you, Senator. Minister.
Just a number of key important points raised by Senator Robbie Gallagher. First of all, the whole issue and debate of services in rural Ireland. Absolutely, as far as I'm concerned, people in rural Ireland should have the same rights to ambulance services and quality health services as people in urban areas. And that, to me, is a very important thing. If we're talking about strategic plans and health service plans up and down the country, I think that has to be an important statement. So it's not acceptable. And what that family went in, and I know you're aware of other incidents, but what that family went through there is absolutely, as far as I'm concerned, as a minister in the government, unacceptable. And the answer to your question is, yes, I will bring your concerns to the Minister and make them a major priority issue, and I'll also raise all the other issues that you raised raise in this very, very important debate, because we're talking about people's lives here, but we also want to make sure that people who live in rural areas are entitled to the same service. They're citizens of this state and they deserve the same rights and protections as the rest of us. Thank you.
Minister, and thank you, Senator.